Question 1. A nurse receives a concentrated vial of potassium chloride, labeled 20 milliequivalent/ml, for a patient with potassium ion equals 2.7 milliequivalent per liter. The provider orders 40 milliequivalent IV over 4 hours. The unit's IV pump malfunctions, leaving only manual gravity tubing available. What is the nurse's safest action? A. Administer manually at an estimated rate using gravity flow. B. Request a pre-mixed infusion with a functioning pump before administration. C. Mix the dose with dextrose and infuse slowly by gravity. D. Ask another nurse to supervise manual administration. Answer. B. Request a pre-mixed infusion with a functioning pump before administration. Rationale. Potassium chloride requires strict rate control via infusion pump to prevent cardiac arrest. Manual drip regulation is unsafe. The nurse must advocate for equipment replacement and delay until safety is ensured. Question 2. A patient receiving vancomycin IV suddenly develops flushing, hypotension, and back pain mid-infusion. The provider is unreachable. What is the nurse's best immediate action? A. Stop the infusion and assess airway and blood pressure. B. Reduce the rate by half and monitor for improvement. C. Call pharmacy for an antihistamine. D. Continue infusion until provider returns. Answer. A. Stop the infusion and assess airway and blood pressure. Rationale. These symptoms suggest red man syndrome or anaphylactoid reaction. Stopping the infusion prevents progression to shock. Rate reduction, B, is inappropriate when symptoms have already developed. Question 3. A float nurse plans to combine insulin glargine and insulin lispro in one syringe for a patient with type 1 diabetes. What is the supervising nurse's best immediate intervention? A. Allow the nurse to proceed to avoid delay. B. Stop the preparation and re-educate on incompatibility. C. Verify with pharmacy before correcting the nurse. D. Document the event after administration. Answer. B. Stop the preparation and re-educate on incompatibility. Rationale. Long-acting insulins like glargine cannot be mixed due to pH differences causing crystal formation. The supervising nurse must intervene before administration, not afterward. Question 4. During a night shift, a nurse is ordered to give crushed oral medications through a patient's NG tube used for continuous feeding. The nurse notes the order includes an extended-release ER capsule. What should the nurse do? A. Crush all medications together to reduce tube clogging. B. Hold the ER medication and contact the provider. C. Mix with tube feeding to ensure full absorption. D. Administer separately but flush only at the end. Answer. B. Hold the ER medication and contact the provider. Rationale. Crushing extended-release forms alters pharmacokinetics, causing dose dumping and toxicity. The nurse must verify an alternate formulation before administration. Question 5. A patient on warfarin has an INR of 6.2 and reports new-onset nosebleeds. What is the nurse's highest priority action? A. Hold the next dose and notify the provider immediately. B. Administer the dose and apply nasal pressure. C. Document and recheck INR in 6 hours. D. Give vitamin K from the unit stock. Answer. A. Hold the next dose and notify the provider immediately. Rationale. An INR greater than 6 with bleeding is a medical emergency. Vitamin K administration D must be prescribed. The nurse's legal duty is to hold and report. Question 6. A patient receiving IV nitroprusside for hypertensive crisis suddenly develops confusion, bright red venous blood, and metabolic acidosis on labs. What complication should the nurse suspect? A. Cyanide toxicity. B. Rebound hypertension. C. Pulmonary embolism. D. Hypokalemia. Answer. A. Cyanide toxicity. Rationale. Nitroprusside metabolism can release cyanide ions, especially during prolonged high-dose infusions. Symptoms demand immediate discontinuation and antidote, hydroxycobalamin. Question 7. During a morning med pass, a patient refuses a new white tablet added to their regimen, stating, "That's not what I take for my heart." What should the nurse do first? A. Check the electronic MAR and verify with the pharmacy. B. Reassure the patient that medication colors vary. C. Consult the provider after administering the dose. D. Ask the UAP to confirm patient's history. Answer. A. Check the electronic MAR and verify with the pharmacy. Rationale. Any patient report of unfamiliar medication signals a potential dispensing or transcription error. Verification prevents wrong drug administration. Question 8. A post-op patient on morphine PCA becomes difficult to arouse, with a respiratory rate of 8 per minute and pinpoint pupils. What is the nurse's immediate action? A. Stop the PCA and administer naloxone per protocol. B. Increase IV fluids to dilute the medication. C. Notify the provider after reassessment. D. Apply oxygen and continue to monitor. Answer. A. Stop the PCA and administer naloxone per protocol. Rationale: opioid-induced respiratory depression is a life-threatening emergency. The nurse must reverse it with naloxone and halt the PCA pump to stop drug delivery. Question 9. A nurse prepares to administer digoxin to a patient whose morning lab shows potassium ion equals 2.8 milliequivalent per liter and HR equals 52 BPM. What is the safest action? A. Hold digoxin and notify the provider immediately. B. Administer digoxin to improve heart rate. C. Increase dietary potassium intake. D. Give the dose with extra fluids. Answer. A. Hold digoxin and notify the provider immediately. Rationale: both hypokalemia and bradycardia increase risk for digoxin toxicity. Giving the drug could induce fatal arrhythmias. Question 10. The nurse is instructed to administer IV phenytoin to a patient in status epilepticus. The IV site shows mild swelling after 10 milliliters infused. What is the correct immediate action? A. Stop infusion and assess for extravasation. B. Continue at a slower rate. C. Flush line to reduce irritation. D. Administer remaining dose IM. Answer. A. Stop infusion and assess for extravasation. Rationale: IV phenytoin is a vesicant. Infiltration can cause necrosis. Immediate cessation and site assessment prevent severe tissue injury. Question 11. The nurse calculates a 5 milliliters morphine dose for a 10 milligrams order from a 2 milligrams per ml vial. The pharmacy label reads concentrate, 10 milligrams per milliliter. What is the safest action? A. Verify the concentration with pharmacy before drawing up. B. Administer as calculated. C. Dilute the dose manually and proceed. D. Ask a colleague to recheck the dose later. Answer. A. Verify the concentration with pharmacy before drawing up. Rationale: morphine comes in multiple high-concentration formulations. Calculation based on the wrong concentration risks 10 times overdose. Verification is mandatory. Question 12. A patient's BP is 158/92 millimeters of mercury, and the PRN order reads hydralazine 10 milligrams IV for SBP greater than 160. The patient complains of dizziness. What should the nurse do? A. Hold the medication and reassess blood pressure in 30 minutes. B. Administer the medication to prevent rebound. C. Notify the provider of patient symptoms before holding. D. Give half the dose to maintain control. Answer. A. Hold the medication and reassess blood pressure in 30 minutes. Rationale: the BP is below parameters, and dizziness may signal orthostatic changes. Giving the dose risks hypotension and falls. Question 13. During shift change, a nurse notices another nurse documenting medication administration for a patient who has been off the unit for testing. What should the observing nurse do? A. Privately confront the nurse immediately. B. Report the observation to the charge nurse or supervisor. C. Document the discrepancy in the patient's chart. D. Wait to confirm with the off-going nurse. Answer. B. Report the observation to the charge nurse or supervisor. Rationale: charting meds not given is fraudulent and a patient safety violation. Reporting ensures risk mitigation and accountability. Question 14. A patient on lithium therapy reports tremors, vomiting, and confusion. The latest level is 2.3 milliequivalent per liter. What is the nurse's priority action? A. Hold the next dose and prepare for IV fluids. B. Document findings and reassess in 1 hour. C. Give next dose with food to reduce GI upset. D. Continue therapy to maintain therapeutic level. Answer. A. Hold the next dose and prepare for IV fluids. Rationale: a lithium level above 2.0 milliequivalent per liter signals severe toxicity. Immediate cessation and hydration help promote renal excretion. Question 15. A nurse draws up 4 milliliters of ampicillin, 250 milligrams per ml, for an order of 1 gram IV. The patient's IV site becomes swollen mid-infusion. What is the correct intervention? A. Stop infusion and start a new IV line. B. Continue infusion and elevate arm. C. Flush with saline to clear blockage. D. Document infiltration after dose completion. Answer. A. Stop infusion and start a new IV line. Rationale. Swelling signals infiltration, which may lead to tissue injury. The nurse must immediately stop the infusion and relocate access. Question 16. While administering gentamicin, a patient reports tinnitus and unsteady gait. What should the nurse do first? A. Stop infusion and report possible ototoxicity. B. Reduce the rate and continue. C. Encourage oral hydration. D. Document and observe for 24 hours. Answer. A. Stop infusion and report possible ototoxicity. Rationale. Aminoglycoside toxicity causes irreversible ear damage. Stopping therapy immediately prevents progression. Question 17. A diabetic patient with poor appetite receives a morning insulin order. The patient eats less than half of breakfast. What is the best nursing action? A. Hold insulin and notify provider for dose adjustment. B. Administer full dose and monitor glucose hourly. C. Administer half dose independently. D. Give dose after offering juice. Answer. A. Hold insulin and notify provider for dose adjustment. Rationale. Administering full insulin with reduced intake risks severe hypoglycemia. The nurse cannot alter dosage without an order. Question 18. A patient receiving vesicant chemotherapy develops burning pain at the IV site. What is the nurse's immediate action? A. Stop the infusion immediately and assess for extravasation. B. Apply warm compresses and slow the rate. C. Continue while notifying the provider. D. Flush to relieve discomfort. Answer. A. Stop the infusion immediately and assess for extravasation. Rationale. Vesicants cause tissue necrosis. The nurse must stop infusion immediately and implement extravasation protocol. Question 19. A patient prescribed metoprolol has an apical pulse of 48 bpm and new dizziness. What is the correct action? A. Hold the dose and notify the provider. B. Give dose and recheck in 30 minutes. C. Administer half the ordered dose. D. Continue to avoid rebound tachycardia. Answer. A. Hold the dose and notify the provider. Rationale. Bradycardia, less than 50 bpm, is a contraindication for beta blockers. Administration could lead to syncope or heart block. Question 20. During a night shift, a provider gives a verbal order for a high-alert medication, but is speaking with a heavy accent over the phone. What is the nurse's safest response? A. Repeat the order back clearly for verification. B. Proceed with administration to prevent delay. C. Ask another nurse to interpret. D. Request the provider enter the order electronically. Answer. A. Repeat the order back clearly for verification. Rationale. Readback is required to prevent verbal order misinterpretation, a frequent root cause of sentinel medication errors. Question 21. A patient in septic shock is receiving norepinephrine and broad-spectrum antibiotics. The nurse notes IV infiltration at the vasopressor site. What is the immediate priority? A. Stop the infusion and administer phentolamine to the site. B. Continue infusion through the same line. C. Elevate the limb and apply ice. D. Flush the site with saline. Answer. A. Stop the infusion and administer phentolamine to the site. Rationale. Vasopressor extravasation causes tissue necrosis. Phentolamine, an alpha blocker, reverses vasoconstriction and prevents ischemia. Continuing infusion would cause gangrene. Question 22. The nurse administers IV lorazepam to a ventilated ICU patient already on propofol sedation. Within minutes, BP drops to 70/40 millimeters of mercury. What is the safest first action? A. Stop propofol and maintain airway and perfusion. B. Administer more fluids while continuing both sedatives. C. Prepare naloxone for reversal. D. Increase oxygen flow rate to 10 liters per minute. Answer. A. Stop propofol and maintain airway and perfusion. Rationale. Combined sedative-depressant effects can cause life-threatening hypotension. Stopping propofol and supporting airway or fluids prevent cardiac collapse. Question 23. An ICU patient receiving amiodarone IV for ventricular arrhythmia develops bradycardia, HR 38 BPM. The provider is unavailable. What should the nurse do first? A. Stop the infusion and notify the provider immediately. B. Administer atropine independently. C. Reduce rate by half and monitor rhythm. D. Flush with saline and continue. Answer. A. Stop the infusion and notify the provider immediately. Rationale. Amiodarone toxicity causes severe bradycardia and hypotension. The nurse must stop the infusion before deterioration. Atropine requires an order. Question 24. A patient with cirrhosis receives morphine for pain and becomes unresponsive. Which concurrent medication most likely intensified the effect? A. Lorazepam. B. Furosemide. C. Ondansetron. D. Metoprolol. Answer. A. Lorazepam. Rationale. Benzodiazepines plus opioids synergistically depress the CNS, especially in hepatic impairment, leading to respiratory arrest. Question 25. A nurse is preparing IV linezolid for a patient on sertraline SSRI. What is the most critical step before administration? A. Notify provider about risk of serotonin syndrome. B. Dilute with normal saline. C. Infuse over 30 minutes. D. Monitor urine output closely. Answer. A. Notify provider about risk of serotonin syndrome. Rationale. Linezolid plus SSRIs may trigger serotonin syndrome, characterized by hyperthermia, agitation, and seizures. Provider must evaluate drug compatibility. Question 26. An ICU nurse receives a stat order for IV insulin drip, while the patient is already receiving D5W with KCL. What is the safest approach? A. Begin the insulin infusion on a separate pump and monitor glucose hourly. B. Add insulin directly into the D5W bag. C. Hold KCL infusion until insulin completes. D. Start insulin in the same line with D5W. Answer. A. Begin the insulin infusion on a separate pump and monitor glucose hourly. Rationale. Insulin requires dedicated line and pump to prevent dosing errors and interaction with other fluids. Mixing with D5W or KCL risks precipitation and variable absorption. Question 27. A nurse is titrating dopamine IV for hypotension when the patient's urine output suddenly drops. What should the nurse do first? A. Evaluate the current dose and titration rate. B. Administer a fluid bolus immediately. C. Increase dopamine rate by 5 micrograms per kilogram per minute. D. Add norepinephrine concurrently. Answer. A. Evaluate the current dose and titration rate. Rationale. At higher doses, dopamine causes renal vasoconstriction, reducing urine output. The nurse must reassess titration before increasing dose. Question 28. A patient receiving gentamicin and furosemide begins complaining of tinnitus. What should the nurse do? A. Stop both medications and notify the provider. B. Continue gentamicin only. C. Reduce furosemide dose independently. D. Document and reassess next shift. Answer. A. Stop both medications and notify the provider. Rationale. Both drugs are ototoxic and synergistic in damage. Stopping both prevents irreversible hearing loss. Question 29. A patient on heparin infusion has APTT of 120 seconds. The provider orders to continue same rate. What should the nurse do? A. Hold infusion and clarify the order. B. Follow the provider's instruction. C. Decrease rate by half without notifying provider. D. Continue and monitor for bleeding. Answer. A. Hold infusion and clarify the order. Rationale. APTT greater than 100 seconds indicates dangerous anticoagulation. The nurse has a legal duty to question unsafe orders. Question 30. The nurse administers IV metoprolol to a patient receiving verapamil. Shortly after, BP drops to 70 over 38 millimeters of mercury and HR 38 BPM. What caused this? A. Additive cardiac depressant effect. B. Electrolyte imbalance. C. Fluid overload. D. Beta agonist rebound. Answer. A. Additive cardiac depressant effect. Rationale. Metoprolol plus verapamil both slow AV conduction, causing severe bradycardia and hypotension. This combination requires close monitoring. Question 31. An ICU nurse draws up a high-alert vasopressor using a multidose vial, but forgets to label the syringe. Before giving, the charge nurse intervenes. What principle of medication safety is this? A. Proper labeling prevents look-alike or sound-alike errors. B. Peer verification before administration. C. Two-nurse check after infusion. D. Waste documentation. Answer. A. Proper labeling prevents look-alike or sound-alike errors. Rationale. Unlabeled syringes are one of the leading causes of fatal medication errors in ICUs. Every prepared syringe must be labeled immediately. Question 32. A nurse accidentally gives 5 milligrams hydromorphone IV instead of 0.5 milligrams. What is the nurse's first responsibility? A. Notify the provider and initiate emergency monitoring. B. Edit the MAR to correct the dose. C. Wait to see if symptoms develop. D. Document as given per order. Answer. A. Notify the provider and initiate emergency monitoring. Rationale. This is a high-alert medication error. Immediate reporting and patient monitoring are required under legal and ethical duty of disclosure. Question 33. A patient on total parenteral nutrition, TPN, develops tremors and sweating during infusion. The glucose level is 52 milligrams per deciliter. What should the nurse do first? A. Stop TPN and start 10% dextrose IV. B. Increase TPN rate. C. Administer insulin per sliding scale. D. Give additional potassium. Answer. A. Stop TPN and start 10% dextrose IV. Rationale. Sudden TPN interruption causes hypoglycemia. Transition to D10 maintains glucose stability. Question 34. A patient with renal failure is receiving morphine. The nurse notes confusion and myoclonus. What is the cause? A. Accumulation of active metabolites. B. Allergic reaction. C. Dehydration. D. Hepatic clearance delay. Answer. A. Accumulation of active metabolites. Rationale. Morphine 6. Glucuronide accumulates in renal dysfunction, leading to neurotoxicity. Dose reduction or substitution, for example fentanyl, is needed. Question 35. A provider orders both ACE inhibitor lisinopril and spironolactone for a heart failure patient. What is the nurse's primary concern? A. Hyperkalemia risk. B. Hyponatremia. C. Hypocalcemia. D. Hypoglycemia. Answer. A. Hyperkalemia risk. Rationale. Both drugs increase serum potassium. Combined use raises risk of fatal arrhythmias. The nurse must monitor potassium ion and renal function closely. Question 36. A patient with atrial fibrillation on warfarin is prescribed TMPS-MX Bactrim. What should the nurse anticipate? A. Increased INR and bleeding risk. B. Decreased INR and thrombosis. C. No interaction. D. Delayed antibiotic effect. Answer. A. Increased INR and bleeding risk. Rationale. TMPS-MX inhibits warfarin metabolism, potentiating anticoagulant effects, and raising INR dangerously. Question 37. During an emergency code, a nurse prepares epinephrine and sodium bicarbonate for IV push. What is the safe administration principle? A. Flush the line between medications. B. Administer both in the same syringe. C. Give bicarbonate first. D. Follow epinephrine with D5W. Answer. A. Flush the line between medications. Rationale. Mixing epinephrine and sodium bicarbonate causes drug inactivation. Separate IV push with saline flush maintains potency. Question 38. A sedated ICU patient on propofol suddenly shows triglycerides greater than 600 milligrams per deciliter and metabolic acidosis. What should the nurse suspect? A. Propofol infusion syndrome. B. Acute pancreatitis. C. Sepsis. D. Fluid overload. Answer. A. Propofol infusion syndrome. Rationale. Prolonged propofol infusion causes mitochondrial dysfunction leading to acidosis, rhabdomyolysis, and cardiac failure. Must stop infusion immediately. Question 39. A nurse gives metronidazole to a patient who later consumes alcohol. The patient becomes flushed, diaphoretic, and tachycardic. What reaction occurred? A. Disulfiram-like reaction. B. Allergic reaction. C. Hypoglycemia. D. Anticholinergic crisis. Answer. A. Disulfiram-like reaction. Rationale: metronidazole plus alcohol causes acetaldehyde accumulation, leading to a disulfiram-like reaction, flushing, tachycardia, hypotension. Ethical duty requires immediate reporting and system resolution. Question 40. A nurse witnesses another nurse giving IV medication without scanning the barcode due to a malfunctioning reader. What is the correct response? A. Report the event to the charge nurse immediately. B. Ignore it since the nurse is experienced. C. Continue practice until IT fixes the scanner. D. Verify with paper-mar later. Answer: A. Report the event to the charge nurse immediately. Rationale: bypassing safety systems violates medication safety policy and increases error risk. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.